Hi, Facebook Live. This is part 2. Don't stop our train. We're going to keep it moving. Once again, I am Dr. Zarina, also known as Dr. Z, your sports medicine, integrative medicine specialist. I'm here today because I want to talk a little to you about cross-training. We had a little bit of technical difficulties, but we're going to keep it moving. I want to get y'all the information. I know that you deserve it. So at the end of the day, I'm here to finish what I started, okay? So at the, we left off, I believe, at the 5, 5, and 5. I was discussing a little bit about how there's different options how you can approach cross-training as it relates to the whole week. So some of my athletes, or sometimes I suggest, depending on what's uniquely going to be beneficial for you, where you may do yoga for Monday, you may do boxing on Tuesday, you may do swimming on Wednesday, so on and so forth, to kind of mix it up, okay? Please, please, please go back to part 1 of the video on www.facebook.com/Dr. Zarina, that's DRZARINAH, okay, to get part 1 so you can get context to what I'm talking about right now. The other side of that was the 5 minutes, 5, 5, and 5. So what that was about was you may only have 15 minutes in your day, but you still want to kind of mix it up so you, for a particular day, maybe one day that you were still switching up through the week with the Monday, Tuesday, Wednesday, Thursday, where you're switching it up, but you may have a point where you're like, oh, I can't do it today. Never say that. That's what I don't want you to do. So my strategy in helping people still pull it in and get some of that cross-training going is through the actual doing 15-minute intervals. So with that 15-minute intervals may be that 5 minutes of yoga, intense yoga, and then another 5 minutes of intense cycling, no breaks, okay? Just kind of keeping it going because you want your endurance to build up, you want your heart rate to build up, so that's what that's about. And then the next 5 minutes might be jogging, okay? So that's kind of what you switch it in. That was what I meant by the 5, 5, and 5. That's 15 minutes, and that gets you at least something in for that day, okay? So the last piece of that was the importance of, if you're not an athlete, you might be like, Dr. Z, is this conversation for me? If I'm not an athlete, how does this apply to me? Could cross-training still help me if I have, we talked a little bit about knee pain or osteoarthritis or diabetes or hypertension. I'm still talking to you, okay? That is still important for you to realize that this is not just, cross-training is not just for my elite athletes. This is for you too. You may not be the elite athlete, but you still need to improve your fitness level or you improve your overall health. You want to actually help minimize your uses of certain medications as it relates to hypertension or diabetic medications. Cross-training can help because it's going to improve your endurance, it's going to improve your flexibility, it's going to improve your core strength. All of those that we know scientifically is going to help put you in a better space where sometimes you completely come off of those medications because, as we recall, many of you know, but just if you didn't, as a reminder, high blood pressure, diabetes, things like that, those are curable, okay? You are curable. Put yourself back in the driver's seat. That's what I'm here to do through different programs and my consulting services. That's what I'm here to do. Put you back in the driver's seat to help you realize that you can have pain freedom, again, right? And that comes through emotional as physical, and you can rebound your health through different tips like this, okay? So that was kind of the gist of it. Some more examples I wanted to give because some of you posted about if I could give some examples of cross-training besides just the benefits. Of course, the benefits is like, okay, what are examples of those? So I like to swimming because it's not as hard on the joints. And if you are someone who does a lot of pounding on your body, then swimming can be very effective because it has a lot more buoyancy. And you're going to also have more effective, which you have to decrease the joint, again, the pounding on the joints, improving your cardiovascular health and benefits. It's my little person. That is not my little person. And as well as, sorry, y'all, background music for my little boo, my little baby girl. As well as different boxing can be very effective for strengthening your core and using different hip stabilizers. That's going to be very effective if you are someone who needs to improve your core strength, okay? Because they'll use different muscle groups in a different way. Sometimes, I'm using runners as an example because they tend to be some of my basketball players and my runners, for whatever reason, they tend to cross-train the least in my practices, are the ones that come to me. So boxing can be very effective because you're going to be using your upper body, your lower body, as well as recovery muscle, right? Because you're going to be using your muscles a little differently than you do when you're doing your very sport-specific exercises. And another one is cycling. I do like cycling as well, and that could be truly on a bike out on the roads, be careful, wear a helmet, do all those good things. Or indoor cycling, which I like a lot because you can switch up the interval, a little bit more controlled environment, and you're also going to be able to be a little bit more, again, a little bit more controlled environment. You have a lot of the cycling bikes in the gyms, or if you have one at home, you can increase or decrease the resistance. That's also going to further impact. Hi, Sandy Matthews. Thanks for joining us. You can also improve your endurance as it relates to that as well, okay? And then another thing I like cycling. It's easy on the joints, going to improve your cardiovascular health, and kind of helps recovery phase in terms of, because you're going to have aerobic exercise, but it's not as pounding on your joints, and you're still improving your aerobic health as well as your strengthening, especially if you're on a cycle bike that has the ability to decrease or increase the resistance. And we talked a little bit about boxing or kickboxing, those also using different muscle groups, upper body as well as lower body, that can be very effective because you're using muscles a little differently to be very effective as it relates to strengthening core as well as flexibility, even with that, and recovery, actually, okay? And what other things I like? We talked about swimming, yoga. We talked about swimming, yoga. We talked about boxing, kickboxing, and we talked about cycling. Those are probably some big ones. Please do leave comments down in the comment section. You can also reach me on the Facebook. You can inbox me if you have any questions about the cross training. There was a little patchy this week. That's okay. We'll keep it moving. You have a part 1, and now here's part 2. Hi, Tracy. Thanks for joining us. Let me know if you have any questions. Again, I am Dr. Zarina, also known as Dr. Z. I'm here, your sports medicine and integrative medicine specialist, here to help you with your pain freedom, rebound your health, and help you understand that you can reach pain freedom. Don't ever feel like you're out of the game, that you can't obtain that. That is absolutely not the case. And through my different programs, my consultant services, my medical practice, and other products here to come in the future, we are here to help you do just that. Rebound your health, reach your pain freedom, knowing that you're in the driver's seat. You are the MVP, and I'm absolutely here to help you get there. Thanks for joining me. And go rebound your health, pain freedom. Peace out, Dr. Z.